So today I'll be discussing an inherited disorder called polycystic kidney disease or PKD, and the patient that was affected by this disease is John Roblio. Background on this patient is that after spending a week in the hospital, he learned that his kidneys were enlarged and contained many tiny cysts. Further tests revealed that he had PKD. The doctors are managing his pain and are keeping an eye on his blood pressure, but for now John is in good health. His doctors mentioned that he may require a transplant someday, but he cannot think about that right now. His wife Marta just found out she is pregnant. They have so much to do before the baby comes. Unfortunately, John did not realize that his condition is genetic. Both of his parents died when John was only 12 years old. So, what is PKD? PKD is an inherited disorder in which uncontrollable clusters of cysts develop within kidneys, causing kidneys to enlarge and lose function over time. The cysts are non-cancerous round sacs and contain water-like fluids. They grow in different sizes and usually grow very large. A normal kidney is relatively small and is measured to be the size of a person's fist. However, a kidney affected with PKD grows to be about the size of a football. PKD can also affect other organs and cause cysts to grow in the liver, pancreas, spleen, ovaries, and the large bowel. It can also affect the brain and heart, leading to aneurysm or strokes, and both lead to immediate death. There are two types of PKD, autosomal dominant PKD and autosomal recessive PKD. Autosomal dominant causes cysts to grow only in the kidneys, and autosomal recessive PKD causes cysts to grow in both the kidneys and the liver. People of all genders, ages, races, ethnicities, and nationalities can have PKD. So here are two pictures of livers that have PKD. To the left, there's a comparison of a football and an infected PKD liver. To the right, you have a comparison of a normal liver versus two affected PKD livers. Some symptoms of PKD are pain in the back and the side, blood in the urine, high blood pressure, swollen abdomen, frequent kidney infections. Here is a pedigree of John's family. Autosomal recessive. Both of his parents were affected by it and both died. His wife is pregnant, and the diamond on the bottom demonstrates her child, and it has a 25% chance of getting PKD. So 3 questions that both of them may ask the doctor is PKD preventable and can it be diagnosed? Ultrasound is the most reliable and inexpensive and non-invasive way to diagnose PKD. There is no way to prevent PKD, however, you can manage the symptoms throughout lifestyle changes and medication to manage the pain. She might ask, can our child be diagnosed with PKD? If her partner, John, has PKD, there is a 1 in 2% chance or 50% chance of the baby getting it and developing it sometimes in his or her life. How common is PKD? In the United States alone, about 600,000 people have PKD, and is the 4th leading cause of kidney failure. So the last slide are recommendations of people who have PKD. Exercise is an important part of maintaining good and overall health. Regular exercise can decrease blood pressure and stress as well as improve muscle strength, heart function, and stamina. Chronic pain is the most common problem for patients with PKD. For this reason, pain clinics that utilize biofeedback and support groups can be very helpful in managing pain. AD-PKD or autosomal dominant PKD can be diagnosed at a very young age or even before birth. Drinking plain water throughout the day and avoiding caffeine in beverages can slow the growth of cysts. Keeping blood pressure in check is the main overall thing that they should do. So that's all for today. Thank you.